Good afternoon to you all. Yes, welcome back from the coffee break, and I hope you're well and energetic for this second education session. And yeah, looking forward to having an interesting session this afternoon. So please also allow me extend our gratitude to the KICS EMAP partners who are still streaming online. They are with us in the first session. And the GPE KICS EMAP, Global Partnership for Education, Knowledge and Innovation Exchange, is a regional platform that connects education stakeholders from over 37 countries across Europe, the Middle East, North Africa, Asia, and the Pacific. So they are managed by NORAG, and the hub facilitates knowledge sharing, peer learning, and innovation to help countries strengthen their education systems and achieve the SDG 4 goal. So through collaborative activities and capacity building, the hub supports evidence-based policy and practice across diverse educational contexts. So we are happy to have you online, and thank you for joining. So for this innovative session on DHIS2, or what we have used DHIS2 for in the education sector, we have presentations from 3 countries, and just to start, we shall have Education Above All that will be sharing the different use cases from Rwanda and Gambia, and then also the Aga Khan Foundation who are here with us, and they've been implementing in Uganda, West Nile region. So just to put it in context, I think before our first presenters come online, come to present, if we remember that the MDG goals were launched in 2000, and this put many countries have come up to put strategies in place to ensure that school-going children gain access to education. So there have been tremendous strides in different countries across the globe, really registering at least even more than 100% enrollment. But then 25 years later, when we are more than midway of the SDG 4 goals, which emphasize learning and not schooling, we need to remember that right now, over 600 million school-aged children cannot read and write. Yeah, so there is a learning crisis. Then besides that, we have over 250 million children globally still out of school due to several barriers. So in sum, I think we have close to 1 billion children who are not actually having access to education or not learning. So this is a global crisis in education. But I think we can do more, right? Yeah, so to address this crisis, we are going to hear interesting innovations that have come in place from the smiling coast of Africa, that is the Gambia, to the land of 1,000 hills, that is Rwanda. Educate a Child has partnered with organizations in these countries to implement innovative DHIS2-based solutions. So these initiatives are focused on multi-sectoral collaboration and technology to enroll and, most importantly, retain marginalized children in school. In Rwanda, the Waliku system allows educational authorities to monitor student progression and identify dropout risks. In the Gambia, a mobile application and comprehensive enrollment database has integrated birth registration data, improving real-time tracking of out-of-school children. So these projects really demonstrate the potential of DHIS2-powered innovations in addressing this global education crisis that I alluded to. So Education Above All has actually a robust strategy that other ministries can leverage on and adapt in their context, really, to see how to approach or address this zero out of school children crisis. So please allow me welcome our first speakers from the Gambia, who will be David Momo from Education Above All Foundation, and Mr. Sidi Ahmed Jallo from the Ministry of and Noor Ansir from the Education Above All Foundation. Then later we shall hear from the country teams. You're welcome, David.
Thank you so much, Monica. Use this. It's okay.
Is it moving? Okay.
Thank you so much, Monica, for the intro. And the intro and the background to what we do. So Education Above All Foundation is a foundation that is based in Qatar. It was established in 2012. Just like she said, that was the era of MDGs. And the aim was to ensure that by then the 60 million out of school children at the primary level, that Qatar could do something to cut down on that number by about 10 million. So when the foundation was formed, one of the key things that the Educate a Child program was given was a target. Can you enroll 10 million out of school children, therefore reducing the numbers? But just as Monica said, so many factors play a role in taking the children to school, because even after us reaching the 10 million out of school children, we still found the number had moved slightly higher. Now the number of out of school children were even more. And even today, there are even more children who are out of school due to wars, due to various things, socioeconomic factors, lack of access due to unavailability of physical infrastructure, poor quality education, and so on. So the vision was that came out about for the Education Above All was by Her Highness Sheikh Amoza bint Nasser as a leader in Qatar. And she had a vision of a world where every individual has an equal access to quality education and employment opportunities. So to do this, we started forming partnerships with different stakeholders, both the UN agencies, non-government organizations, working with the governments to make sure that we get children back to school. So for some of the presenters who are in the other room, I was talking to some of them and telling them, even if we are not going to present their countries here, we are active in almost all those countries. We've been in Togo, we've been in Nigeria, we've been in Gambia, Rwanda, and 37 African countries in total. We've worked close to 70 countries by now across the world, but the majority have been in Africa. So Education Above All as a foundation is massive in terms of the number of programs it has. Educate a Child, whom we are representing with our partners here, has the largest portfolio, but we also have others who are working with other sectors. So we work mainly at the primary school level with the out of school children and making sure that those who are in school are also retained. Then we have a group called Alpha Hura who are working in higher ed. We have an advocacy group called Protect Education in Conflict Areas. They work in conflict zones, trying to help or prevent the attack against education institutions and personalities. We have Reach Out to All. They work with the youth on green skills and climate change, which we were told is the youngest baby in DHIS2. We have Silatech, who are working with the fixing the youth employment issues. We have an innovative department. We have a group called Together, which is trying to place those children who are out of school in the country, inside the country of Qatar, to school. And lastly, we have a fundraiser group in London that is known as ESCI International. So I don't want to go into these details because what we are addressing today is mainly what Educate a Child and the partners are doing in terms of out-of-school children. So the Zero Out-of-School Children was an initiative that came about after we addressed the initial problem which we had of reaching 10 million out-of-school children. Then we asked ourselves, what more can we do? So we thought if we could target a few countries which were almost at a universal primary education level, then we could try to see how we can help as many children in these countries go to school and we get to the number zero. And that's why we call it zero out of school children. So the four countries were Djibouti, the Gambia, Rwanda, and Zanzibar in Tanzania as a region. We are working in the region of Zanzibar, and we provided some technical and financial support to these countries through the partners that we work with to try and come up with an education system that is responsive to the needs of these children in those countries. So the initial focus was on getting to an obsolete zero out of school children. But as I've explained, we learned lessons along the way that it's not that easy. However much resources you put into place, we know even countries like Norway do not have absolute zero. There's still some children who may not be able to access the formal kind of education, or what is called what we rate as the education at different levels, because they may need specialized attention due to other issues. And therefore, we thought we are not going to focus just on the number, but on how to address the systems so that we can make sure that every child has a chance, whatever the kind of education they get, we'll be able to give them the literacy foundations that Monica was talking about. So we've shifted to more of system strengthening, and that's why we are trying to look at things like how do we address the data systems to capture and support planning in education in every country. And availability of data is key to this. As we all know, we saw that in the previous sessions that we had in the other room. So we have the presentation among four of us. So I'm going to ask Nu to come and take over for the next session, and then we leave the country level partners to continue with the other stage. Thank you very much.
Allah, can you hear me? Thank you, David and Monica, for a wonderful introduction and background. I won't take much time, to be honest. I'll allow our partners to come in and then talk about the real life field experience in relation to what we are doing. I'll just talk about the importance of data in the zero after school strategy that we are implementing in 4 countries. As you heard earlier, there are 250 plus million children after school, which is in this world is really unacceptable, I would say, to the least. And with all the technology, with all the development, with all the modernization, we are still lagging behind and we're not reaching so many millions to provide them the basic rights of education. So that's a challenge which we have for last 25 years plus, and it continues to remain there. And despite, as David mentioned, that we enrolled 14 plus million after school children, the needle hasn't moved yet. It's still there. And we are, in fact, increasing in the numbers due to a variety of reasons, better data, better accessibility to the information, and so on and so forth. So we, in the initial few years when we implemented the zero after school strategy in 4 countries, we learned that it's not an absolute number. We have to look at it from more system point of view, whole system, and instead of rather focusing on the numbers, we focus on the individuals. We say that if you are not counted, you don't count. So we have to see it as the whole child system, and then how that can be tracked over its life. So starting from the birth to then the learning and the development and employability. We say learn before earn, or learning to earning. I don't know, there are a lot of slogans around it, but we need to put that into practice. My colleagues will talk about it later on about it. The main issue that we have identified in the last decade is there are so many invisible children to any data system in any country. So many, like millions of them. They are on the move, they are displaced, they are, I don't know, conflict affected. So the government or any administrative data doesn't see them. So you are not counted. And then once you put them in, they are not learning or they are dropping out. So the cycle continues. We need to put plugs into the dropout hole. We need to reach out to those who are invisible. So that's where it comes that we focus on the individuals and then reach out to them instead of like bringing them to the education. We say the education has to reach to them. It's the other way around. So if we look at it from that perspective, that will be good. And the other thing is, I'll just focus on 2 more points and then pass it on to our colleagues. The one is that we need to do collaborations and cross-sector integration. It's once we focus on the individual or child, it's not education, it's not health, it's not climate change, it's not, I don't know. There's so many ministries that are involved into serving a child or serving an individual. So what we are now focusing and pushing is to work a more system cross-sector, multi-sector approach so that all the ministries, I was very happy to hear from Nigeria that they said 20 plus ministries are using one system. While we have, I don't know, 20 plus systems used by one ministry. This other way around. So I think that's where we need to really focus on. So multi-sector, ministry or parastatals or departments, we have to like work together. And the main element is to strengthen the civil registry. It's not the responsibility of alone health sector or education sector or anyone else. So any service reaching out to any individual, especially the child, should be able to capture the child data right from the birth. If they miss at the birth, then later on, if they interact, for instance, in Gambia, if they interact with the health facilities or health services, their data is captured right away. For vaccination, for illnesses, for anything, so they get all the data there. What we are working with, my colleagues will be talking about to integrate the health data with that. But there's also civil registry, planning commission, and others who need to use their data for budgeting and resource allocation and all that. So if you keep just data between the 2 ministries, it's not going to work. So focus on the individuals, especially those most marginalized who are invisible to any data. And the second is cross-sector, multi-sector approach. The third one would be any technology or any solution that we are working on should be focusing on user friendliness, easy to adopt, easy to maintain. When we support projects for 2-3 years, they are good, they are putting together all the systems in place. The moment the project ends, all the technology goes off and it doesn't sustain. The sustainability and the user friendliness or adaptability is really important from the data point of view. So with that, I'll just allow our colleagues to come in and then share their experiences from the field. Thank you so much for your attention.
Okay, hello. Okay, fine. So good afternoon, everyone. Thank you very much for giving me this opportunity to present on behalf of my colleague who unfortunately couldn't travel, but they are listening online and the whole team is with them. So if you see me shaking, it's not because of stage fright. I'm really cold. It's so just a warning. So I'm here to discuss the use case of the Gambia and how we have been able to leverage support from EAC and the semis that we have in the Gambia to try to do something on early warning system. So the early warnings project in the Gambia is a multi-stakeholder project that involved the Ministry of Education, who act as mainly the data repositories, the ones that are responsible for data management and tracking. And then you have the implementation arms, the advocacy arm, that's another education for all network, campaign network, who would go into this field and then talk to parents and then talk to community leaders after when we have identified the gaps. And then we'll have um, um, child fund who are also working with us to try to intervene in these situations. When we bring the children back, if they are in need of, for example, for support, bicycles, or any of this infrastructure to be able to support them to come to school, they are responsible for that. So as a whole, the issues of the AC started in the Gambia in around 2022, and then after that we had our initial mapping of all the out of school children in the Gambia, and we had like 80,000 approximately in the Gambia. And ever since we've, after doing the mapping, we had this, the opportunity to intervene, talk to the parents, and then try to bring these children to school. But when they come to school, one of the critical things that we have to ensure is to make sure that they stay in school. And the first mapping tools that we used was not sufficient, was not equipped enough to be able to help us understand exactly how the children come to school, and if they are, how exactly are they maintained, are they in school, and as well, even the other children that are also in school to not add to the ones that are already out of school. So to make sure that we are able to come up with this system that we call the early warning or dropout risk system by assigning risk scores to children to understand the kind of risk that they are associated with, and then develop a warning system based on this. And for that, we needed because we are looking at things, early warning is a little bit complicated, dropout specifically. We had to look at components of enrollment, attendance, and performance to be able to get these indicators. And for that, we used SEMIS as a background, as a base to be able to collect this data. And we did that in 60 schools. We piloted in 60 schools where we focused on one grade. And then in each of the schools, they were like at the 3 most affected regions in terms of dropout in the Gambia. And based on that, one of the first questions that we asked ourselves was, what exactly is dropout risk? How do we calculate this risk index? And as we know, just doing a little bit of background, we came up with many, many reasons. But a quick background, a quick investigation into the internet will tell you that you have most of the critical reasons for dropout usually is really in relation to attendance, performance, and discipline. But because we don't have data on disciplines, we are trying to combine these two. We take the attendance of the children, most specifically absence, and then the performance, the average scores in the core subject, and then try to combine them. The highest risk is the one with the highest absence, and then with the lowest performance. So this is, I know, again, this is just a disclaimer. Dropout is a little bit complicated as it can also tie to your individual characteristics as a parent. You might be an orphan, which could definitely affect your dropout risk. And these are all things that you have to consider. But for now, just to scope it down, because down to the data that we have, and again, we can extend this. If you are able to track these details of the children as you go, then you can make this more and more and more complicated as you go, so that you can accurately identify the children that are at risk. So based on that, we decided to create some visual indicators, green for low, yellow for moderate, and red for high risk. And then based on that, using the DHIS2, we've implemented with the SEMIS. We went to 60 schools, trained them, give them the system, and most of these head teachers and the class teachers were using their mobile phones to record the attendance of these children daily. And based on that, we were able to generate this risk scores for the children. And this allows the schools to pinpoint exactly the child, the grade, and and then try to intervene, either to talk to the parents through child fund or through the other agencies that we are working with, so that they can address this problem. So some of the challenges that we face as well, like in every developing country, is the issue of connectivity. One, because we base this implementation on our already existing SEMIS infrastructure that we were using, that is relying on a VPN connectivity to make sure that the schools are accessing the system and reporting to these systems without having to bear the cost of connectivity. But also the network infrastructure in many of these rural areas where we are intervening, where the dropout was poor, there was a very, very poor connectivity in terms of, because most of those networks were more like on 3G, and whereas you need to send data and load some of these apps would require much faster internet. And there was a lot of manual data support that we had to do at that end because of the absence of IT team inside the schools as well. So because initially, using the data, the attendance data and the exams data, we had to pull out this data, turn it into Excel, generate this early warning analytics that we have shown you, and then share this with the schools. But with the support of HIS2 and Central Africa, we are trying to digitize that process as well to develop, to make sure it is automated in a dashboard where all of these indicators, which we have already started working on, would be presented, and we would be able to share this with all of this, including the schools, the head teachers, and all the way to the national level. But we have to find a way for us to make sure that publicly available to all of these levels, because it is in a standard report format. And then what are some of the next steps that we have seen? So this implementation for us provided the opportunity, because when we implemented the SEMIS, that is the underlying infrastructure, it was designed in a generic manner with no specific use case in mind. But the early one in this Zero Out of School project has given us the real use case of exactly why we are developing individual systems. Why are we going to develop individual student level systems to be able to do something like this? And it gave us a lot of feedback that we have shared with the team, who have also continuing developing, and some of the things that you will see are probably based on some of the early warnings that we got out from this. So the next is exactly how do you expand this beyond the one grade and one school into the 60 schools, but to make sure that it is nationwide, because our dropout is a thing that is not only focus on the areas where we have the highest dropout, but it's a national phenomenon. And you can also have urban issues, like most of these districts that we are in are rural, but we also have a high dropout rate in the urban areas, but for different reasons. So these are all things that we have to look at. And then one of the key things that we've also been trying to establish since at the very beginning was this link to health data. Because the only way that we can get to zero out of school is to make sure that we connect to this pipeline of health individual data. And once we've able to establish our systems and be able to track, then we can connect to the health pipeline, get the children at birth registered in our systems, and then if they are not in schools, depending on their locality, we will be able to follow up, before they even before it gets too late for them. So this was yes, that was my presentation. So thank you very much, everyone.
Can you hear me? Check. Okay. Can you hear me? Okay. Okay, good afternoon, everyone. Thank you so much for this opportunity to present the Rwanda case study. My name is Mohini Venkatesh, and I represent the Waliku team at Save the Children. But I'm really here to speak for all the work that has been done in Rwanda by the Ministry of Education, Education Above All, as the key funding organization, Save the Children, and partners such as Humanity and Inclusion, as well as NUDOR. So it's a multi-stakeholder intervention. And really what I'm going to talk to you about today is one small part of a very large program, 5 years, of engagement. And the project started in 2023, late 2023, and goes on till 2028. As you can see, the focus of my presentation will be on absence tracking of in-school children as a dropout prevention strategy. So very similar to what you heard earlier from CD, from the Gambia use case. A bit about Waliko and Save the Children and who we are. We're a digital data and analytics team for education. We've been working closely with the University of Oslo and the HISP centers across East and Southern Africa and West Africa across different projects. As you can see here, currently we support the student absence tracking system in Rwanda, but we also work with the HISP community in Ethiopia, looking beyond enrollments and attendance, also at performance monitoring, and in Mozambique for student and staff enrollment and attendance tracking. And we've had other experience in the past also looking at school health interventions using DHIS2. So just a bit about the intervention in Rwanda. As you heard, it follows the Zero Out of School Children Initiative of Education Above All, and the goal being improving access to and retention of children in primary education. The starting point for this project is really the identification of out-of-school children, the target being 177,119 out-of-school children. And we know there are many more than that in the country, as we've learned from the last year and a half of implementation. Seeing that they're enrolled and retained in the project, and over the course of the 5 years have a system that is really strongly grounded on data that ensures those children who have been brought back to school stay in school, and there aren't children dropping out, as you heard from Noor earlier, trying to really plug that hole in the education system, with children being in school but dropping out, and then children out of school coming in, but then they don't complete their education. So implemented across all 30 districts in the country, reaching all 3,213 primary schools, both public and government aided. Sorry. Okay, so what is the digital system and what are the components to it, from identifying and enrolling out-of-school children to absence tracking and dropout prevention for all learners? So it's not just the out-of-school children we identify, but all children in school. So we used a suite of solutions to achieve our objectives. We started with the out-of-school child data collection, which leveraged ODK, or Open Data Kit, and Keto forms. This was something that the Ministry of Education recommended and hosted on their servers. The second component is the school data management system. It's the Ministry of Education's own system for school and student data management. It's used widely across the education sector in Rwanda for everything from school census, teachers and staff census, student enrollments, also in terms of assessments, examinations, performance monitoring. So this, in essence, was the upstream system for all the master data that we needed, and also the system that would help us determine if those out-of-school children are truly enrolled in back in the schools, physically, but also digitally. Are we finding those children from our field surveys back in school now that those outreach activities have happened, and we know that there has been effort to see that they come back into the schools. Oh, I know something's happened here. But I hope you can read that. That's DHIS2 EMIS. That's the downstream system that CD also talked about that is being used to record and visualize student absence information. It integrates with the upstream SDMS through a backend process that I will now explain shortly on how we achieve that. And then for our visualizations, we rely both on what is available out of the box in DHIS2 through the built-in dashboards and standard reports, but we also utilize Power BI to visualize the out-of-school children, their return to school, and also absence tracking dashboards for the national and local governments to understand what's happening across the country. So really using, as you see here, a visualization software that meets the needs of different stakeholders, the DHIS2 at the local level, in schools, but then Power BI for the higher level stakeholders. So this is just very briefly, I don't want to get into the technicalities of it, but we can have a separate discussion for those who are interested. The Ministry of Education provided a replica of their SDMS and the SQL view from that then helped to run a job that helped to pull, transform, and load the data from SDMS into the downstream DHIS2 EMIS platform. And I'd like to just give a shout out to our colleagues here at SAW Digitis, Alfredo, and so many other colleagues here who helped us through this process of integration. And in order to see that are we really, are the two systems matching each other, we developed a dashboard that helps us to constantly track that, yes, the children on the upstream and system are matching with those in the downstream system. With every change that happens in the upstream system, be it a new child that has been brought into the school or a child that has left, it needs to refresh the downstream system so that teachers can see their children in the system and take attendance. Take their attendance. Now, here are some dashboards that we developed. This is the school level dashboards using standard reports that provide a detailed view of individual learners at risk of dropout. The charts were designed and developed with the Ministry of Education. We had a series of consultative sessions where they said, this is how we look at risk. So you can see on the far left there, the bar chart, which you can't read it very clearly, but it gives the different levels of risk from never to rarely absent to being at very high risk of dropout. So based on the absence rate, a child could be at the very left or at the very right of that spectrum. And a school principal or a teacher could then focus in on those individual learners that need urgent support. Similarly, at the Ministry of Education, through their Power BI dashboard, they're able to see various information at an aggregate level, which will tell them what is the absence rate in my overall or in these districts, provinces, what are the main reasons for those absences, what is the extent of CMIS being utilized for tracking digital absences, and again, what are the categories of learners across those never to rarely absent all the way to high risk of dropout. So really the lessons learned for us in the last year has been that we need to collaborate very closely with all stakeholders from the ministry to the local governments and schools, as well as with our DHIS2 community of practice to make this a successful initiative. the upstream data system has a very big impact on the local downstream system. Continuous monitoring is important. The usage of CMIS as a digital system for absence tracking is impacted by various factors, including the integration, the user friendliness of the system. And really, we're talking about teachers who've never or rarely used a mobile phone for this kind of daily job, task that they would perform pen on paper. So you're really changing the way people just for one activity take attendance. So it really needs to, app usage depends on the end user and how easy the system is for them to adopt. The integration certainly made it much easier to roll out because schools could readily start tracking absences of learners. And I'm here today also to have more discussions with colleagues, all the technical colleagues here, to see how those user-driven requirements can be considered in the product roadmap as we further enhance the utility of DHIS2 CMIS. Thank you very much.
No. Yes, so thank you very much, Ibra. You're very welcome. And thank you to the team that has presented from Education Above All and CD from the Ministry of Education, Gambia, and Mohini from Save the Children. Thank you for sharing your country use stories. So I think you will allow us, please, maybe go overboard by 5-10 minutes because we are running late, but just to have an interactive discussion. So the next session, the next presentation is by Mr. Ibrahim Juchi. He's from Aga Khan Foundation, Uganda, and they are operating in the West Nile region. Uganda, I think, is the largest country hosting refugees in Africa. So in that region, there are so many refugees, so many children coming into the national education system. So they've adopted DHIS2 that is being implemented in 4 districts, and now they've scaled it up to 2 districts in West Nile, and he's here to share with us, beyond the individual level tracking, beyond the school, what is happening at the middle tier and how the districts are really using this data. So welcome, Mr. Ibrahim.
Okay, so test 1, 2. Are we there? All right. Good afternoon, everyone. Let me hope I'm clear to everyone. It's just a disclaimer as well. It's a bit cold and I come from a place that is always very hot. And by this time of the day, everyone would wish to take off their shirt. So this was a very long journey for me. It took me 16 hours from London to Oslo, but I'm trying to recover from the journey. So nevertheless, let me go through the presentation. For Aga Khan Foundation, this is a new thing for us. It's a learning curve, and we are new to the community of practice, and we have stories to share. So that is why I'm here, and thank you so much, Sophia and Monica, for giving us the opportunity to come and share with all of us here. So my name is Njuchi Ibrahim, doing monitoring, evaluation, research, and learning coordination for Aga Khan Foundation, specifically Uganda. So in this presentation, I'm going to give just a brief background of who we are as Aga Khan Foundation, talk through the Foundations for Learning intervention that is helping us, take this to scale. And then what are the sort of, data management challenges that really existed so that we could, take the decision to take on DHIS2. Then the brief journey about the adaptation and piloting of DHIS2 and some of the challenges that really still exist. So it's not a magic bullet that every challenge that we had in terms of data management has been eliminated, but it's a learning curve and we've got some early success to share. So briefly about the Aga Khan Foundation. There's a lot of information on the internet, but this is part of the Aga Khan Development Agency. It's a network of different setups, from the hospitals to the Aga Khan schools, to tourism, where we have Serena hotels. But specifically, we have the Aga Khan Foundation that is doing the development work, the NGO work, if you will. So the foundation was established by His Highness the Aga Khan in 1967. And it's a non-profit organization that is striving to improve the quality of life in the most needed parts of Asia and Africa. So specifically, it focuses on the investment into the human potential, where we have human and then the technical resources that are put together to address the challenges, but over a period of time where we are striving to improve the quality of life. So our areas of focus in terms of the thematic areas, we are into early childhood development, education, civil society, then agriculture and food security, as well as economic inclusion. So that's the brief about the foundation. Specifically in Uganda, we have interventions in the northern part of the country, which area is called West Nile. West Nile because it's west of River Nile in the northern part. So we have interventions also in the central part of the country, in Kampala, Mukono, and so those of you who are familiar with Africa and East Africa to be specific. So if I can scroll through, we have a project that we've been implementing for 5 years, and it's funded by Global Affairs Canada. This project focuses on eliminating barriers, specifically girls are facing in terms of staying in school. I come from a place where there are certain problems that have been persistent over the years. Early pregnancies, early marriages, menstruation mismanagement. Some people call it management, but mismanagement, if you will. So some of those factors are barring girls from coming to school. So this project has been focusing on some key areas of influence. Our approach, we have schools, we have teachers, communities, the civil societies, as well as the local governments where we work. So our approach is that improve the environment in the schools, give capacity building to the teachers, then work with the communities to ensure that they are part of the support to ensure that all the barriers are eliminated or reduced, and then work with the civil society organizations that are rooted within those communities so that once the projects end, they can stay behind and continue with the work. And then if you empower the local governments with the systems, the tools and the support, the continuity of the work can go on. So what are those sort of challenges that existed before we try to adapt and adopt the DHIS2? Fragmented data collection. What do we mean here? So we had quite a cocktail of problems when it came to data management. There are quite a number of partners coming with the different tools, different approaches, different science, and the politics that comes with that science. So we're like, how do we bring all this together? How do we come up with something that can help the area? So inconsistent reporting. So everyone, it's a cobweb of different problems and challenges. Who is reporting to who and who is receiving what? So that was also another problem. Governance and accountability issues also existed. We come from an area where data is a hot cake. All different partners, UNICEF, mention all the different NGOs, including even the government. Everyone needs data. But you find that there are specific numbers that are given to the different partners according to the need, which brings a lot of quality issues. So all these problems existed because of the fragmented data collection, the systems. And then foundations for learning intervention. The intervention had a huge aspiration in terms of improving data management. So they were talking about an application called Promise 3, and our board was like, Promise 3? It was promising almost everything. So, and it had a lot of quality issues, and it fell dead on arrival. So, huge budget, huge aspirations, but the application never came through. You understand what I'm talking about? Because the government has systems, different partners have systems, schools have different systems. So it's a basket of everything, and our people consume whatever comes. So the limited data infrastructure, somebody mentioned it here, even in Uganda still, the technical know-how in terms of the systems, in terms of how to use even the basics of go to the Play Store and download an application. Those are some of the problems even people still have. So we had quite a number of problems. But I'm not saying that DHIS2 is doing the magic to eliminate everything, but we are in the right direction in that regard. So what is our progress so far? So we are fairly new, but we are trying to learn from the existing challenges. So this is our small journey, which may be a small but a huge step forward. So August last year is when we started. We introduced the platform to the senior management. We have a senior management that is very critical. I have my colleague here, Sarah, is part of the team. So you need to present a case to the senior management that how different this is. So we started, and I'm glad to say that when they looked at the dashboard of the DHIS2, they were like, yeah, maybe this is the what? This is the thing. So and I said, okay, we are getting somewhere. And then we got the buy-in. So we introduced the same to the local governments, because there is a lot of fatigue even in the local governments where we work. So many partners are coming with the different platforms. You know, people have started ICT and IT, and people sit somewhere and develop applications, and they think that they can work anywhere, anytime. So we had to do an introduction. We took with our colleagues, HISP Uganda, and then the ministry colleagues through the local governments, DHIS2. We trained 35 district officials from those districts, bringing on board the different departments on how the system works and how really it can help, address some of the challenges that I've mentioned. And then the next step is that we had an opportunity to introduce the same to 200 schools, covering 90% of the schools you can imagine in the localities. The advantage that we had that gave us a head start was the fact that we had distributed already over 200 tablets to these schools, but we are grappling with what exactly should we use these tablets for? Because Promise 3 had not come on board. So the quickest thing that we looked at was using Kobo Collect, you can imagine. So how did we come into the journey? So at one platform, we are doing our data reflection, and we had our colleagues from the ministry who had worked with HISP Uganda. So we were juggling between the different Excel files that are downloaded from, you can imagine you have 200 schools, they've submitted Kobo, you download, you do the analysis, and you're playing different computers here. And our colleagues were like, no, this is not the thing that that you really need. So that is the transition that we've got. We've transformed from the survey tool, which is predominantly helping out surveys, which is COBO, then to the DHIS2, which has, say it's early, but there's a lot of successes that we can still share with you. So what are the key early successes that we can share? The quick availability of data, both at the institutional level as Aga Khan Foundation. We have a cycle of reporting. So we are able to get real-time data because you can log into the system, do the quick overview and present to the board what exactly is happening. Improve the reporting. So specific examples that I can share, the attendance. An area like Arua City, people can be able to see what the attendance is in terms of the different schools. We come from an area that has challenges around the geography, where a district inspector has to ride the motorbike 70 kilometers to check who is absent, who is not present, who is present, who is not. So this can be now seen from the platforms. Inspections. Inspectors have now adopted the termlet tool of variables rather than the inspection approach of going and finding faults. But now there are variables that have been included. And then the performance tracking and academic analysis. Arua City has gotten an analysis of the last 5 years of the primary living examination, the national examinations from the school. So they can be able to see the performance. Data is highly political in Uganda. And there are certain places where people look at the data and like, no, maybe the one who entered this. It's a very interesting discussion. So it is giving an advantage to people to make decisions concerning what exactly exists. So the data-driven planning and resource allocation in Yumbe district, the district is able to look at the DHIS2 data and know that we have a problem here. For example, we are talking about girls being out of school, but later on they are discovering that it's actually the boys that are not there. You understand what I'm talking about? So these are decisions that our districts are taking. So what are some of those sort of challenges that exist? We have low levels of ICT utilizations amongst the challenges. I've told you here, we come from very remote areas where people don't even know how to use smartphones, leave alone having them. And some even get challenges just, downloading an application from the Play Store. You can even take 1 hour trying to direct people, go here, go there. And even there are head teachers of schools that hire people to type for them documents. You get what I mean? So it's a challenge that still exists. So we have 200 schools, but the submission of the data is still a challenge to some of the schools. You have around 80 schools that are struggling because of the ICT, because of network issues and the power issues that don't allow them to, have charge on their phones. And then we have challenges around limited resources because we want to expand. We are into the West Nile region, but we want to expand the DHIS to other portfolios like the agriculture. We have early childhood. So how do we do that with a limited resource envelope? Thank you so much. That is the user case that I wanted to share with you. Yeah.
Hello.
Hi. Yes. Yeah, it's on. Yeah, so thank you very much, Ibra. Thank you for that wonderful presentation. And so we can take a round of questions. We have some questions that have come in through the online, the KICS EMAP community that is online. But if there are any questions on in the audience, please feel free. Any questions? All right. So we have a question for the Gambia team. Someone would like to hear more about how you developed the risk score and built agreement around it and determined the cutoffs for the different dropout risk levels.
Yeah, thank you very much. And that's a very important question. And like I said, the issue of dropout is very, very contextual, and it depends on a lot of variables. And back home in Uganda, we had to make the decision based on what was available and as well what we could find. So we did this initial assessment, and then we realized that back home it is much more relevant. It is much more risky for a child that is absent to drop out than one that is not performing well. So we decided to apply these weighting measures, based on our estimation of the impact of each of these. So we decided to say 75% risk is maybe associated with attendance, and then 25 risk is then associated to performance. And then we had this, the formula is not here, but we have this formula that kind of calculate the outcomes of this based on, the overall scores, and then we these two together, and then it developed this risk scores. But it was something that we had to decide, and something that was also with support from the master students who have also been coming to the Gambia, who've also shown interest in the early warning and have been investigating some of these risks. Because as well, even in terms of attendance or absence, the reasons for absence also matters. So is it sick? Is it, for no reason? Back home, Gambia, you realize that probably the ones that are absent for no reason are more likely to drop out than the ones. So these are all things that you have to consider and then, put together. But you have to, the idea is you have to, like she said, you have to come to a consensus to agree that this is how we are looking at it, and then that's how we implemented it.
Yeah. Yes. He needs the mic. Thank you, CD. Thank you very much.
Oh, sure. So Scott Patrick, I'm a strategic advisor here at the University of Oslo, focused on platform governance and ecosystems. So my question is, we are soon embarking on a big project in DHIS2 to start to incorporate data from e-learning platforms. So like students who are engaging with tablets and phones and stuff like that to get some part of their educational materials, curriculum, etc. And I'm wondering, kind of, and the experts in the room here, how could that data be complementary to the data that you're already getting? Or what kind of possibilities can you imagine that? Because it's happening quite quickly, and hopefully by the next few months, we'll have some integrations already set up.
I think it's clear. Yeah. I think reflections from from the room. Yes. CD, do you want to give it a shot?
Okay, again, that's a very, very important question, but also a hard one. Again, one of the reasons why most of our countries, including the Gambia, went for individual is to be able to monitor these learning outcomes, to be able to determine the children that are not performing and the areas where they are lacking. And then this kind of learning analytics tools is what is usually going to inform you of the specific areas or specific courses that the children is not doing well, the specific topics in these sessions. And that is one of the second use cases that we'll be using the SEMIS in the short term, at least in the Gambia. We are thinking of in the next year, we are already in the planning stage, but at the start of the next academic year, we are working with sub-partners who have been intervening directly in pedagogy, but not through using an online system, but more about tracking, going to the schools, determining, examining the children based on a specific assessment tools, learning assessment tools, and then try to determine which areas are they performing well and which areas are they not, do they understand well or don't understand, and use that to inform the teachers and then train them during the semester breaks so that they could do well in those areas. And integrating this kind of data is one of the primary use cases that we have there in the Gambia. And I'm sure some of the discussion that we've also been having, there's a lot of opportunity to integrate these learning outcomes that the SEMIs would be able to track and then determine the weaknesses of these children, their learning weak points.
Yeah, thank you very much, Sidi. Yes.
I think Sidi has really answered the question well, but just in addition, currently I know there are students also learning through these online platforms like Sparks Maths, and which evaluates the students' work on a weekly basis. And therefore, if a student is not performing well in certain areas, it alerts the teachers and shows areas of possible improvements. So by working with existing systems, it would be also easy to capture the indicators which can be used in this DHIS2.
Yeah.
Thank you very much. I just wanted to add a couple of things. I think this digital learning or e-learning platforms are on the rise. So there are already a couple of hundreds, I think more than that. I was in Paris with the DTC conference, and there were like ad tech solutions everywhere. So, and the other thing is global comparability of the assessments. We are talking about the learning poverty or learning crisis, but based on what
metrics?
Of each school, each district, each country has a different type of assessments around the learning. As it's mainly in literacy and numeracy that we assess, but not the knowledge. So if we are assessing education, I think we need to broaden it more based on what is available digitally. And then we have to come out of this centuries-old mindset or approach to the education. It has to happen within the four walls. A teacher, a warm body in front of few warm bodies on this side. That has to change, and that's where the e-learning and digital transformation comes in. And then whatever we are doing, it has to be comparable at the global level, at least at the country level or national level, especially as the digital transformation is kind of fast changing the environment. We have to like welcome that, not to resist just in the name of privacy, confidentiality, this and that, or the data issues. But I think this is an opportunity that's coming to us, and then we'll see how we best utilize this. Thank you.
Yes, thank you very, very much for those comments and the questions, and the people online. Thank you for your questions. I think some of the comments were around sharing the presentations. They will be shared later on. But thank you very much to you all online and also in the audience for joining. And for me, what I see here is really we need that to strengthen our collaboration, because we are, integrating different systems from different departments, different sectors. We are talking about digital capacities. So all this really presents a very enormous opportunity for us, but also challenges in terms of, how do we manage this data? And if we are to incorporate like learning analytics, how do we mine this data? So maybe also DHIS2 has to think around, how can we go into deep data science to really analyze this data and make meaning out of it. So, and I also see an opportunity for cross-country learning and sharing, because these tools, for example, the early warning systems that have been developed in Rwanda, Gambia, can be shared across other countries. So these are really opportunities that we can tap into and see how we can really improve the education of our children. So thank you very much once again, and have a good evening, and bye to the people online. Thank you.
If you have a moment, please make use of the QR code.